Okay, fantastic. Well, today I'm really delighted to be interviewing Professor Timulak. He's course director of the Doctorate in Counselling Psychology in Trinity College Dublin. Has written and published really extensively on psychotherapy, including on emotion-focused psychotherapy. But his research interests are far broader than that, and hopefully we'll get a chance to talk a bit more about that. But I'm really delighted to welcome into Clinical Psychology podcast today. So thank you very much for joining us, Ladislav.
Thank you. Thank you for inviting me. Porek, is it? Do I get it
Indeed. Yeah, that's right. Completely. Yeah.
Porek.
And I wonder if we could begin. I mean, I know some people will know you very well, some people will not know you that well. So I'm wondering if you could begin by just telling us a little bit about the kind of journey professionally that kind of brought you to being course director in Trinity College Dublin now.
Okay. So as you can tell from my accent, I'm not from Ireland originally. I originally come from Slovakia. I'm in Ireland since 2005. So it's about 16 years. It'll be in July, 16 years. And I applied for a job in Trinity for this counseling psychology doctorate. Previously, I was a counseling psychologist that trained back in Slovakia. I had some research stays. Part of my PhD I did in Belgium, and I did my postdoc in US as well before I came to Trinity. So anyway, but I applied for the job that I'm still in the job, that's the job that I
Okay. Wow. So in some respects, it was worth staying for.
I think so. Yes, I'm here. I have the whole family here,
Mm-hmm.
And my wife is a clinical psychologist as well, so we resettled in Ireland and we are still here, and kids are going to universities. The girls are doing leaving cert, so.
Fantastic. That's wonderful. And we're glad to have you as well. And you mentioned having traveled and done different research, including in Belgium. In terms of what was perhaps the most influential experiences professionally, what comes to mind, or what would you say, or would you point to as having influenced you most professionally so far?
So, I did my PhD on person-centered therapy that still, when this was in mid-90s, yes, and its impact in academia was a little bit on a decline back then, yes, and but I was in the context of Slovakia, it was still a live approach, and this is where I did my PhD on significant events in person-centered therapy. That brought me to Belgium, where was a lively experiential therapy center at Catholic University of Leuven that was set up in the 60s by Rogers, actually.
Wow.
In collaboration with. Yeah. So, and that's, you mentioned my interest in emotion-focused therapy. So that's like a current humanistic incarnation of humanistic therapy, is that has its roots in person-centered and Gestalt therapy. So that was then my link, and I did postdoc at University of Toledo in Ohio with Robert Elliott, who was one of the main figures in emotion-focused therapy world. But that was professionally, it was humanistic therapy early on, and
Mm-hmm.
in some ways, I'm still kind of linked to it, so.
Mm-hmm. Mm-hmm. Well, some people have said that often professionally, the first form of psychotherapy we get introduced to is a bit like first love. It lingers with us much, much longer on. But in terms of emotion-focused therapy and say its current iteration in Ireland in practice, I mean, I wonder, what would you say attracts you about this way of working rather than, say, the variety of other models that's out there?
Okay. So I think some of it is always, what you get exposed to is, and what the tradition of the training program you are in and professors that influence you is. So in terms of humanistic therapy, more broadly defined, I was influenced by a professor back in Slovakia, Vlado Hlavenka is his name, who met with Rogers, and he brought person-centered therapy to Czechoslovakia back then. And so this is one thing, that you have tradition, yes, but then there is a passion, is something you see, therapy sessions, you get training program, you see, kind of distinguished therapists doing therapy. So in terms of EFT as such, what was very pivotal, I knew the work of Les Greenberg and colleagues academically from books, yes, from mid-90s, that the approach can be backdated to mid-late 80s, early 90s. And I knew the books, but it was when I invited Les Greenberg to be in Dublin in 2006. And as a part of it, I also saw him working in terms of a small practice that is of experiential nature. And it was very transformative. It was very poignant, his way of working. I think it's not captured in his books that are more technical and academic, but emotion-focused therapy is a research-informed approach in a way that it tries to harness the most fruitful, the most poignant moments in person-centered Gestalt. And akin therapies, I mean, from other approaches, schema therapy is perhaps the most similar in that it tries to access and activate in session the core vulnerability that usually centers around feelings. I feel unlovable, unloved, alone, insecure, unsafe. And it tries to activate that vulnerability in imaginary dialogues and articulate unmet needs in this type of feelings, like to be validated, to be seen, to be protected, to be connected to, or to feel loved, and so on. And in therapy, we are trying to generate adaptive experiences that where the sense of I'm alone is a sense of I feel connected, or I feel loved, or I feel loving towards somebody, or where the feelings of I have no value, that there are feelings I can be proud of my accomplishments, but these are real experiences, yes, and or feelings that I'm afraid and scared, that suddenly I have experiences I feel powerful or stronger, I can protect myself, and so on. So it's very poignant work. Basically, you are going to the core of vulnerability through kind of provision of safe empathic relationship, but also through the work through the use of imaginary dialogues with a pivotal kind of kind of enacting pivotal interactions with others or with the parts of the self, and we are trying to activate the vulnerability and then respond to the need in that vulnerability by generating different types of experiences. So anyway, it's very poignant. And seeing Les's work, I mean, there's a lot of APA videos of seeing Les Greenberg to work. One of the famous Norwegian therapists, Helge Ronenstedt, said apparently to his Norwegian students, I've heard from Norwegians, that if you want to become a good therapist, you should read, and I don't know who it was one of the major philosophers, and then you should watch Les Greenberg's Doing Therapy. That's the combination. So there is something very poignant, yes, about EFT, and that what drew me into that approach. So it was a little bit tradition that I knew of the approach because I had that background in humanistic therapies. But then I had a sense of learning. I had a sense of being moved, seeing Les working. And then, I did training with Les and supervision with Les. I had some training in EFT previously in a few years before I kind of did this training with Les in 2001 and 2002. I was 6 months in Toledo, Ohio with Robert Elliott. So I had initial training. This was a part he offered training to his, it was actually PhD in clinical psychology program, and he was offering a year-long EFT training to his PhD students, and I took part 6 months of that. So I had previous exposure to EFT, actually, important to forget, but then kind of seeing Les's work further kind of solidified my interest in EFT. Anyway, yeah, so that was important. I mean, Robert's influence as well, Robert Elliott's influence on me. That's
sure. You remind us of some of the great giants and the great people that have gone before who have influenced the development of this. I'm kind of curious also, because you say it's quite a powerful mode of working in a way. So I suppose I'm curious from both the side of the client and the therapist in that regard. I wonder where your thoughts are about kind of readiness for this kind of work, or pacing of this kind of work with different clients. Will be those, I imagine, who are ready and willing and immediate to jump into that kind of more profound level of engagement. But what are your thoughts about those who maybe are a bit more wary as they step into consulting?
Yeah, I mean, obviously to bring vulnerability into the session, it's first you have to have a capacity to be able to do it. Yes, so many clients, many people may be quite fragile or in a fragile kind of period of their life where to touch on pain and bring it and activate it, it can be overwhelming or too much. Is so all of that requires like a proper assessment. Yes, are they able or to stay and bear the pain, and
Mm.
only then you can work in more transformative way. So often people just need support, yes, to get on with the pain rather than kind of more transformative work trying to transform that pain. So that's one thing. Yes, so the work also kind of varies depending on the assessment and presentation of the client and client's capacity to stay with the painful emotions and so on. That's one thing. The other thing is, it was studied mainly in the context of depression. And now, including here in Ireland, we studied it in, we just finished a relatively big RCT on EFT for generalized anxiety disorder. This was in comparison to CBT, but we had a line of research, previous 2 studies. So this was a third in line on developing and adapting EFT for GAD. There were studies in Israel on social anxiety and in Scotland as well on social anxiety. There was a study, there were 2 RCTs on complex trauma in Canada with the adult survivors of child abuse. So this is where we know more, yes? I mean, there are some initial studies on eating disorders. So it wasn't applied, but beyond that, in terms of research, obviously clinically it was applied. And even if you work with people with depression and GAD, they may have comorbid presentations,
Mm.
like personality disorders and so on. But it was mainly studies what would fit primary care presentations, right,
Sure.
like depression and anxiety. We just finished study with the HSC's NCS. Hopefully, we'll submit it soon for publication. Soon, I mean within 2-3 weeks, and this was in the context of a primary care provision, yes, in HSC, and yeah, I mean, this is the most typical, but we are now, for instance, running a trial where we are adapting it as a transdiagnostic approach that also includes other presentations similar to anxiety, like OCD.
Mm-hmm.
These are I mean, there are further developments to be. It's like
Sure, sure.
any therapy. Most likely, it starts with depression, and then you go and try to adapt it and
Ah,
maybe adjust it for other presentations.
no,
And
it makes sense. And I think the kind of trans diagnostic approach, I suppose, appeals much more with many psychological models than perhaps a psychiatric classification system.
yeah, but even those transdiagnostic approaches are somewhat that they stay with the clusters of approaches of presentations. So,
Yeah.
for instance, the study we are doing includes depression, GAD, social anxiety, panic disorder, PTSD, OCD. So this is the span. It doesn't include, I don't know, psychosis or something. So,
Mhm.
though it's transdiagnostic, it's still just for a cluster of
Mhm.
presentations. It's not for everything.
Yeah.
This is the nature of transdiagnostic approaches. Like the first ones, this is not EFT, this is CBT. Furban's work in the area of eating disorders included anorexia, bulimia, and other eating disorders. But it was all eating disorders, although it
Mhm.
was
Sure.
transdiagnostic to cover all of them. Yes,
Sure.
anyway.
And if we kind of move from maybe the client to the therapist, if we think that there are some clients who are ready or maybe less ready for this kind of more transformative work, do you think there are some therapists who are more suited to doing EFT or are at a different stage in their development that are more suited to doing EFT?
Okay. So I do a lot of training of therapists. I'm one of the kind of trainers, international trainers recognized by International Society of EFT. And so I did have opportunity, apart from training our own students, also to provide trainings in Ireland, but also internationally, including in, let's say, in Asia, in countries like China or
Yeah.
Singapore, but also in many European countries. And so I know quite a lot about can people learn this approach and what type of therapists, psychologists learn this approach. So there is a variability. So I think some people are more naturally drawn to this type of approach and are perhaps more. I try to avoid the word talented, but perhaps talented, yes, to work, because this is how they function. You know, they're more reflective. They're more attuned with what they feel, experience, and it's easier for them to articulate. So it's easier for them to learn it than yes, and be like this with the therapist. But I often say to students, you know, that I could learn it, so maybe others can. I mean, that others can learn it as well, because I had to expand how I am normally. It's not my default way of being.
Okay.
So I think anybody can learn it, although the journey may differ, and a lot of it is learned through supervision. You know, I mean, through own work in terms of reading, watching videotapes of other therapists, but most of it is learned through supervision. And there's a lot of experience across the globe in terms of training. So there are good books on learning EFT, an APA book by Robert Elliott and Les Greenberg, Rhonda Goldman, Gene Watson, and so on. There is a lot of tradition and a lot of knowledge around how to train people to learn this approach, and everybody can learn it. I mean, professionally, obviously, people may not prefer it, or they may struggle with it. Yes, some people more so than others, but it's teachable.
Sure.
It's possible to learn. Yes.
Okay, fantastic.
If you won't be drawn, sorry, if you won't be drawn, then you will not want to take training in it. But
completely.
we expose all trainees on our doctorate, you know, that all have the experience in learning EFT and CBT and the psychodynamic approach. And, you know, for some of them, EFT is the most popular one. For some of them, psychodynamic approach. For some of them, CBT.
Sure, completely. You touched upon something there, which I just wanted to kind of come back on, which is about the kind of online element to a lot of this now. And I know we're even speaking online in the kind of current context. And I guess I'm just curious about it in a way, because I suppose emotion-focused psychotherapy feels a very intense, profound, human-to-human kind of contact. And you mentioned both EFT potentially online, but also other forms of therapy you've been studying online as well. I'm just kind of curious about your thoughts about doing therapy in this virtual way.
Okay. So there are two things. One is like video-based or Zoom-based or phone-based therapy, where we basically venture face-to-face therapy to this other environment. It mainly COVID. I mean, obviously some professionals were doing it before COVID, but COVID kind of moved the whole field, yes, to Zoom or similar type of platforms. So that's one thing I can comment on this, and I think you aim also at an online CBT, internet-based CBT that is actually not using video conference and that it's kind of pre-established. It's more like psychoeducation offered online, but it's interactive. Yes, so I can comment on that as well. But first about the video teletherapy is the word it is now. I mean, like everybody, I had to learn over the last few years. I also offered training and all the teaching through Zoom-like platform, and I did therapy like this, individual couples therapy, and so on. So I think it's much better than I would have thought.
Okay.
It has also downsides, but you know, the upside is, you know, you can reach people. It's safe delivery in the context of pandemic. Downside perhaps is I found it quite tiring, because you have less clues that you see when you interact with the clients. So I have to concentrate much more, you know, I have to be scanning the screen, you know, the window is small and you don't see everything, you know, facial expression. And the therapy is based on a lot of perceptions, you know, because we feel emotions. It shows in our breathing. You can get teary, you know, your voice quality may drop or change. Yes, your posture may suggest that something is happening. So a lot of emotion-focused therapy is based on perception of the therapist. And that's possible over, you know, if you have video available, or on the phone, you listen to the quality of voice, breathing, pauses, poignancy of what is being said. You have to be checking in more often, you know, what's actually happening and so on. But it's possible, but it requires a lot of concentration and learning. Yes. There is a paper actually that I was one of the participants on provision of tele-chair work, imaginary dialogues across several approaches, including schema therapy, emotion-focused therapy, compassion-focused therapy. Matthew Pugh was one of the authors. I don't recall the other author now. There were two authors. They interviewed about 20 therapists. So I was one of the interviewed therapists. And it's published, yes. The journal, what will be the journal that it's published? I think it's Psychotherapy Research, but I'm not sure. And anyway, so I was keen to learn from others what were their experiences.
Yeah.
Yes? People are learning. You have a lot of papers on it now, yes, like with the tips and so on. So I shared my tips, I shared my struggles, and I was keen to read other people's struggles, with it and tips and so on. So anyway, but it's a great paper to read because it summarizes perspective of many people who use experiential work over video teletherapy.
Sure. No, I mean, really looking forward to reading that. And do you think chair work is doable through video?
It's totally doable. Yeah, I mean, obviously there are some challenges that you have to adjust. You have to test. Can you see people? Can you hear them as they were swapping the chairs? You almost have to try it out before you would ever use it. Can it actually work? You have to scaffold it because the level of comfort people have to do it may vary, but it also is, you have to do some scaffolding in face-to-face format anyway,
Sure.
So there are further challenges. You may see less, because they are swapping, they may not be looking at you because they engage the other chair. So there are challenges, but it's doable. It's possible.
Fantastic. This is really kind of fascinating to hear the different experiences, especially globally, in trying to do this work. And where we don't have a huge amount of time to, I wanted to get your opinion also on a slightly different tack, which is about, you mentioned some of the references that I think was a PhD in clinical psychology program where you did one of the kind of initial training programs. I guess I was curious to get your perspective on the evolving nature of psychology in Ireland, but to kind of educational, counseling, clinical, these different branches as they've kind of evolved over time. And what you make of these differences and what you think the future lies, or where do you think it's going to go in Ireland?
I'll go to that. I promise you, Parag, I also feel responsible. I have 2 research labs and I didn't mention the other one.
Okay.
This is the online CBT. I started about.
Oh, yes. Yes.
You actually asked me about it, and then I again went just to you.
It's my fault.
No. That's me. But I said that this is what I had to learn. Yes, but I had an engagement with an internet-provided interventions. I wouldn't call it psychotherapy, but rather internet-provided mental health interventions. And one of them, the big one that I'm involved in, and I'm co-directing a research lab on. It's a internet-based CBT, and that's thanks to Derek Richards, my co-director of that lab. Derek used to be a long time ago my PhD student with a background in computer science and psychotherapy. And he is now one of the leading experts in the world on online mental health interventions, and particularly on online CBT. And he collaborates with this Irish company, Silver Cloud, and I think he's chief science officer there. So I learned through him about this world, that it does exist, internet-based interventions. And we have very thriving research program here that has impact, that the interventions developed by company, but many of them tested by people involved in the research lab, some even up beyond that, kind of led to establishing this type of interventions as low intensity interventions provided in NHS on a large scale and across the world, actually. So this is something that I got enriched, with my humanistic background, traditional psychotherapy. Kind of meeting Derek led me to appreciate other ways of interventions that suddenly in the COVID era kind of had a huge edge. So I wanted just to mention that, yes, and
completely.
And I'll go back to your take on psychology in Ireland. I'm here for 16 years, but I'm still an outsider in a way. I mean, I'm not outsider for the last 16 years, yes, but I don't have the whole tradition beyond that. I mean, what was here before. So I think that the training and how it developed, it's embedded in the history and in the tradition, and and I think it has still impact on how the training looks like is, and the level of collaboration there is or isn't is between various specialties like clinical counseling or educational or beyond that is health psychology, forensic psychology, and so on. So I'm not fully sure what would be your specific interest to know my perspective on. I'm very happy to
Yeah,
provide it.
well, I mean, and again, I'm aware we'll potentially run out of time because we've kept to a tight time frame here. But again, one of the papers in the most recent edition of Clinical Psychology Today has suggested that maybe it's time for a more integrated training approach, almost like a doctor of applied psychology idea, whereby people may have a slightly longer training, but would subspecialize into maybe clinical counseling, educational. That will require a much greater degree of integration and collaboration between training courses in Ireland. Do you think something like that would be feasible, or are we too far apart for that ever to occur?
So, I think that in principle, I mean, there are two things. I personally, I have very pluralistic identity, I could call it is. Like I'm a psychologist in the first, from the first perspective. So I'd be very much open to discussions around something like this. Yes. So that's one thing. The other thing is that the identities are developed, and people may feel strongly about those identities, and they have historical context, how they developed and what they meant in particular time, whether it's in terms of training or jobs or and so on. So I think, and historically, when specialties developed, I don't think that there are many realistically many instances of them then getting amalgamated. Once you differentiate and specialize, it starts to create its own identity. So I'd be a little bit cautious about this. Yes. Whether it's realistic. What, however, is present, like if you look at US, for instance, I mean, all professional programs accredited by APA follow the same standards of accreditation. Yeah? So they are not specific clinical counseling school psychology in an American context. You have some integrated programs. It's very few of them, but you have few clinical/counseling or clinical/counseling/school. So you have those programs, you have them in Canada as well. And I think it's also facilitated that regardless of whether the program is clinical counseling or educational, it still has the same standards that it has to follow in terms of accreditation. So that naturally allows for some of the programs being, kind of covering more than one specialty. But those programs often started as already covering more than one specialty, like from the bottom up, rather than they go to integrating something. Or they broadened themselves up. I'm aware of a counseling psychology PhD in Toronto that is now counseling/clinical. But I mean, the basic identity is still there, that was there before it kind of expanded or something. So I'd be very much interested in it, but I think it also is a natural development, yes, and embedded in context, and there are various forces that have impact on it. But I think to have shared standards, is a good idea.
Sure, sure. That sounds great. And just as a kind of final question to you, and I suppose you referenced this a little bit earlier about the pandemic and the impact upon us all, I guess, of living through this extraordinary year and a half or so at least. Do you think, are you left feeling more hopeful or less so about the role of psychology in responding to people's distress, given what we've lived through in the last year and a half?
So I'm not sure whether it's we are still in the middle of the pandemic. We feel like it's ending or something, but we don't know what it is. So I think our perception of the relevance of pandemic may be quite different 3 years from the pandemic, 5 years, 10, 15, 20, and so on. So I don't know. Obviously now it's very topical, and everybody can appreciate that it had, everybody, I mean by broader society, that it had huge mental health impact, yes, or emotional impact, you could say. So I think that in that sense, it made relevance of psychology in the Irish society, but broader internationally, I think more, I mean, it perhaps broadened the societal awareness of the potential contribution is of psychology in terms of addressing the suffering is that the pandemic brought. So in that sense, I think we did offer a lot, you know, kind of being able to offer teletherapy, having those internet-based interventions. I mean, being really frontline workers, yes, throughout the pandemic. So I think psychology proved itself that it can contribute beyond kind of traditional pathways of care areas that are normally established. So, but I don't know whether pandemic from long term will have, you know, whether it will bring any transformation or shift. My sense is, you know, I'm in psychology since early 90s, and it's you know, I spent about 15 years in Slovakia, 16 years in Ireland, a year in Belgium, you know, several months, 6 months or so in US. I have very international context in terms of collaboration, trainings, and so on. So I'm quite aware of what's happening in other countries. And if I reflect on last 30 years, I think that psychology, it's interesting, it's growing. I think that the societal acknowledgement or recognition of the value of psychological interventions, mental health interventions. And so I'd be hopeful. I think that society is sensitive. I mean, obviously, society, I refer to Irish society, but broadly beyond the Irish society, I think it's truly global, that there is more awareness. Even if I go to China, is the provision of psychological therapy is growing there.
Fantastic.
And the awareness of value of it. So I'd be quite hopeful that we have a lot to offer, that we are getting better in what we are doing, you know, that the research is leading us in constant adaptation, innovation and development, including like the online provision in various forms. So I'd be quite hopeful overall, regardless of pandemic, in terms of the role of psychology in a broader society.
Well, listen, I think that's a really nice, hopeful note for us to finish up today. But I just want to say thank you so much, Professor Timulak, for giving your time today to Clinical Psychology Podcast.
Okay, very nice to meet you, and thank you for inviting me to talk to discuss these things.